Welcome to DentiMax Electronic Health Records. Today we're going to show you how to capture important meaningful use data points as well as how to create clinical notes. DentiMax is a great place to capture a patient's current problems and historical information. Not only can it capture meaningful use relevant information for government incentives, but it can also capture important details about the patient's history. No need to search for that missing piece of paper from the patient's chart. By capturing this information at chairside, you can help your staff avoid unnecessary trips to the chart rack. The patient's historical information is available at every screen in your office. We also have e-prescribing. In our e-prescribing, you can simply do a quick search. We'll do a search for insulin to add medications to your medication list, or to also add in medications to your allergy list. You can also, of course, do e-prescribing from our e-prescribing system. We even have a place for favorites. Here we're selecting the favorites for common allergies. We also have customizable templates. This particular set of templates was created by a husband and wife team. The husband was a dentist and the wife is actually a physician. They created these templates for their high-end clinic, and it does a great job of helping to capture a lot of relevant details for your office. Notice that you just click on yes or no and you can answer with pre-populated text in the note, or you can actually type into the note section. Here we're capturing sensitivity information for the patient's teeth, and then going down below we have a place for sleep apnea information. Going down even further, we've got a place for tooth care, and notice the pop-up list where you can click on the answer to the question and then choose from a list. That makes the data entry really fast to capture all of this information. Previously you may have been capturing this kind of information in a paper chart. Well, the nice thing about DentiMax is that you can capture it all in the electronic health record. That way it's immediately accessible to everyone in the office on their computer. That will help you reduce trips back and forth to the chart rack. Also notice there's a section for pregnancy information in this particular template. Next, you can actually populate an exam template. So here we can indicate the types of exams that we may have performed. Also notice there's a place to capture coding. This coding will drive right into the charting system, the dental charting system that we have. This helps you capture missed revenue. Here you can mark the occlusal class. These are all questions that you probably should be taking in your clinic but might not be necessarily, or maybe it's on paper and you'd like to create a way to capture it for all of your patients. Also here we've got a place where you can capture procedure note templates. Simply right-click and choose the procedure note you'd like to use. You can even add more than one procedure to the note. Let's say you wanted to add another procedure, and then here we have a tooth selector that's part of those procedure notes that you can enable in the system. Again, all of those notes are completely customizable. Now let's go into our coding. Here we can take those codes that were automatically populated into our notes based on the questions that we answered, and we can move them to our treatment plan inside of our charting system. This takes us straight into billing. Additionally, you can provide patient education to the system, and it will track how often you provide patient education as well as the type of patient education that you're referring to. You can use a URL or a web address or a file on your computer for that patient education. Here you just indicate that it's been performed, and then it will be listed in our meaningful use dashboard. Here you can see what the printed chart note looks like. You can simply print this out and give it to their patient, or you can provide it to other physicians where you might be referring the patient out somewhere else. Next, we'll show you how to move the coding to your ledger. You simply go to the coding section, make sure that you have it marked as move to treatment plan, and then when you go into your dental charting inside of our dental charting system, you'll notice that those codes have been added right into our ledger. DentiMax is essentially one software system. The billing and the clinical and the charting are all connected. In the next part of our program, we have our Meaningful Use Dashboard. The Meaningful Use Dashboard is very effective. You can use any date range, which is really nice. Some systems do not allow you to use a specific date range, like a current day or a week at a time or a month to date. We allow you to do that and don't restrict you to measuring your data to a particular period of time. Additionally, you can see exactly how the meaningful use measures work under this description tab. You simply click on the measure and then click on the description tab, and then it will show you basically how to put that information in. Additionally, we have the ability to pull quality measures as well as trend quality measures. So if you'd like to trend your quality and also set goals for your clinic, you can put in that goal. Here we have 50%, for example, on tobacco cessation, 80% on tobacco use assessment. If you wanted to make sure you were meeting a certain percentage of your visits to those goals, this is a great way to start to measure your own quality inside of your clinic. If you're interested in getting one of the incentives, either from Medicaid or Medicare, keep in mind that you can get up to $63,750 from Medicaid and $24,000 from Medicare. You have to choose between the two programs if you happen to be taking both payers in your patient mix. The Medicaid option requires that you demonstrate that you have 30% of your patients from Medicaid, and the payment schedule is as follows: $21,250 in the first year and $8,500 per year for the next 5 years after that.